Okay, we'll get started. Thank you for coming. I appreciate you being here. I'm going to make it worth your while. Be here for close to an hour. And if I don't address all of your questions, I'll be here after that to address them personally here, or you can have an opportunity to get a couple of ways to get more information if you'd like. So my name is Dr. Ed Markowitz. I've been in practice for over 40 years. And I've always had a practice that was involved with the whole body, not just the digestive system. And I've lectured on many, many topics, and I've had a very, very diversified training. I am the clinical director of Advanced Wellness and Injury Center. It's in Danbury. It's about 12 minutes from here. And I've treated over 15,000 patients in the greater Danbury area. And sometimes I also consult with people across the country by telemedicine. I am certified in functional medicine. You'll learn a little bit about what that is. It's still a kind of a term that most people don't really know what it is. So after today, you should know what that is. And I think it's different than what you've been experiencing as far as traditional medicine is concerned. And it's not as a substitute for your traditional medical doctor or your family doctor, but it's in addition to what they're doing. And I usually find that people are here for reasons. They have something that they haven't solved, or they'd like more information about it. So that's what I'm here for too. I'm a member of the Academy of Anti-Aging. So if you'd like to get older slower, I talk about that too, maybe a little bit today. If you, I was a member of the Danbury Spinal Surgery Committee and dealt with all sorts of very, very severe spinal problems, and was referred to by the other doctors on the committee, neurosurgeons, physiatrists, pain specialists, physical therapists, and these were people who weren't really getting well in spite of having surgery or told they couldn't have surgery or they had multiple surgeries. So many times there's lots of ways to fix the same problem. And that can be the case with digestive problems too. Let me go. Okay. There's a doctor on my staff. Her name is Dr. Rockenow. She received her undergraduate degree from Skidmore College and her medical degree from Columbia University and Yale Medical School. She's board certified in family medicine and anti-aging medicine. She's also certified in the use of Botox and collagen injections. She has over 20 years clinical experience in practice, and her care includes expertise in the areas of physical medicine, anti-aging, natural solutions to pain and female hormonal problems, nutritional counseling, and wellness care. I always read this mission statement to any group that I speak to, and I'm going to read it to you now, and then I'm going to ask you a question about it. Anybody who gives me an answer gets a prize. So it's a big prize. That's a joke. Okay, so we're a unique multidisciplinary team of professionals dedicated to providing high quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, and our community on how to sustain a lifetime of optimal health and wellness while limiting the need for drugs and surgery. So every word in that statement was very, very carefully thought out by myself and my staff. And we haven't changed a word in almost 30 years. And so I always ask, what are the words that are most important to you? If there's a few words in that mission statement that are the most meaningful to you, let me know.
Limiting the need for drugs and surgery.
Okay, well, that's been my purpose for almost 40 years. This is a little card that will actually measure your mood by measuring your temperature. And you can also see how you can change it too. It'll tell you a little bit on the card about how you can change your mood and your stress response. So limiting the need for drugs and surgery. And if you notice, I didn't say eliminating the need for drugs and surgery because they're necessary, but I try and reduce the need for it. And I've been very successful at doing that. And I'll give you an example. of one of the doctors that worked with me. He was an internist. He was also trained at Yale. And after 2 years of working with me in our holistic health center, he said, you know what, Ed, I've been here for a couple of years and I prescribe 1/10 the medication of what I used to prescribe when I was in a practice of 9 other internists. So think about that. So he learned a lot about things that he really wasn't trained in. He didn't know anything about, well, he took about 4 hours of nutrition in his 8 years of medical training. He didn't know much about exercise. He didn't know much about stress reduction. He didn't know much about acupuncture. He didn't know much about rehabilitative exercise, excuse me. There were lots of areas of his training that really weren't covered in his training. So he learned that those things help people also. And so when you combine traditional medicine and alternative medicine or functional medicine, many times you get results without needing as much medication or any medication many times. And we'll talk a little bit about that too. Okay, so you filled out the stress survey. Did I get one from everybody? You don't mind? Take a look at it. Okay, thanks. Anybody else? Like, you get one from you guys?
I gave mine.
You did? How, how long ago? When you first, okay, you filled it out a while ago. I've got it now. Okay, thank you. Okay. Drusilla? Yes. Nina? Excuse me, sorry. Okay. So I see a variety of problems that you're still experiencing, and you came here perhaps to see if there's some other things that could be done for them. And I would say that these all are problems. I only put problems on this survey that I have helped successfully. So, but everybody's a little bit different. Okay. I'm going to ask you about some of the symptoms that you wrote on here. I'm just going to give you a little chance to answer that. And I think my purpose is to teach you something about health in general. Anybody here who had headaches as a symptom? Yes, okay. So headaches are very common. Lots of people have them, and there are many ways to alleviate them. What do you do if you get a headache? Just out of curiosity.
I'm sorry.
How severe it is?
Yeah.
Okay.
Oh, my brain.
Mm. Okay, that's common. How many times? Yeah, okay. That's a good temporary solution. And how often will you get headaches?
I know that I think it's over exercise.
Some exercise might have aggravated it. Okay, so the thing I want you to think about, all of you, is if you use something to get rid of pain, it doesn't have to be headaches. First of all, it's a common problem, but it's not normal. It's not normal to have headaches. It's not normal to have any of these symptoms. We were really designed to really alleviate our symptoms. Our body is miraculous. It can get rid of lots of things on its own. Sometimes it takes a little time and treatment. But I would say if you take something, do you ever take anything for your headaches?
It was the final thing.
Yeah, what is it that you take? Okay, so think about this and think about it with some of the other problems that you also might have checked off, or some of you also, other things that you might have checked off. This is a tough question. Do you think you got headaches because you had a deficiency of Advil? Because you didn't have enough Advil in your system. Do you think that's why you got a headache? No. Does anybody think that for any of their symptoms that you? No? Yes? Maybe? Okay. So I would say that most of the time that's not the reason for the headache. So it's really a way to kind of cover up the symptom instead of getting rid of the cause. And that's why you sounds like you still get some headaches on a regular basis. I think you haven't gotten rid of the cause. And so functional medicine is designed to get rid of the cause, not just name a headache or name what it is. It doesn't matter really what it is. Really, what's most important is why you get it. And then we can figure out a way to get rid of the cause. Okay. So did anybody have more than one symptom on this survey? Yes. Okay. And what that means is if you have more than one symptom or the one symptom you have occurs more than once a week, you have a problem you should be concerned about. Again, think about that this is not normal. It's just common. Lots of people have these problems. It's never normal to have a symptom. A symptom is your body's way of telling you that something's wrong, almost like the dashboard on a car. If something goes wrong, it lights up somewhere or gives you a warning. And that's what these symptoms are. They're warnings that something is wrong. So would you check your car? If the engine light went on, symptoms are a warning that something's wrong. There's no such thing as a normal symptom. Most people would check their car to make sure it didn't get worse. I don't think there's anybody here who would put a big piece of black tape over their car light. Anybody? It sounds ridiculous, but that's what people do with their bodies. Sometimes they're just putting a piece of black tape over the problem so that you don't see it or you don't feel it, but it doesn't mean that you got rid of the cause of it. So your body deserves same attention. You take your car to the dealer or to the mechanic, and you'd want him to figure out or her to figure out what was wrong, fix it, and ideally, it doesn't come back. That's the ideal solution. This is another couple of questions. Who would rather be wealthy or just not poor? What's your choice? Any? How many people would rather be wealthy? Just raise your hand. Okay, no wrong answer. Yeah, Helen says, I'd rather be wealthy. How many people are happy just not being poor? Okay, you could actually have both answers. Okay, would you rather be intelligent or just not stupid? How many people would rather be intelligent? Okay, I would too. And this is an intelligent group then. Okay, and would you rather be healthy or just not sick? I want you to understand what the difference is. So if you're healthy, you really have minimal symptoms, if any. If you're just not sick, you could have something really, really causing a problem and you don't even know about it yet. For example, 40% of people who have heart attacks had no symptoms at all before they had the heart attack. About 40% of people who had cancer had no symptoms at all before they had cancer. So I believe, and I practice this way, that the best approach is prevention, is making yourself healthier so you don't get these problems. Today, you have two choices regarding your health. You can do the same thing you're currently doing, getting the same results, or you can try something new, do something different, and get a different result. The choice is yours. If I could show you today how to get rid of your problems by doing something natural and affordable, would you do it? Raise your hand if you would. Just curious if you're open-minded enough to do something about it. Okay. So what is functional medicine? Functional medicine is a branch of medicine that really has been around for about 40 years. I was lucky enough to have the founder of functional medicine as my teacher. He was in my professional school, and he actually is the person who founded this concept of functional medicine. And that's why I got inspired to practice this way, getting rid of the cause of problems. I'll tell you what it is, optimizing health and improving function. That means the way your body works and reversing disease. Our bodies were designed to be healthy. Anybody think of an example that proves that our bodies were designed to be healthy? Do you think we were really designed to have all of these problems? We're designed to feel them, but we weren't designed to have them. So what do you think? How many people could prove that our bodies were designed to be healthy? Think of an example. Well, let's think of something simple. If you cut your hand somewhere, and is it the Band-Aid that heals the hand? Is it the antibiotic you put on it that heals the hand, heals the cut? No, we have a mechanism inside of our body that's designed to recover from that. So I would say that that's really one of the miraculous things about our bodies. And if we don't do something to aggravate it, then there's a good chance. And if we do the right things to help it, then we can recover from a lot of things. So if you rub dirt in the wound or in your hand, is it going to recover? Is it? No. Or if you, so we want you to do the things that really, really are going to help you recover from whatever you checked off on this questionnaire, if that's what you'd like. The functional medicine approach is to identify and address the root cause of any disease or symptom. The body can heal and defend itself against all types of problems if the cause is removed and just not covered up. So my opinion is that everyone should add a functional medicine specialist to their healthcare team. Again, not as a substitute for your doctor, in addition to your doctor, because you're still having some problems where you're not feeling as good as you think you should in any way. Okay. These are common digestive and health problems that I have treated successfully and naturally. Anybody heard of leaky gut? Yes? Okay. What do you know about it? And it's not a test. So if you don't know very much about it, or you know a little bit about it. Okay, yeah. Correct. It really means that the lining of your intestines has been damaged to a certain degree, allowing things that aren't supposed to be in your bloodstream getting into your bloodstream and affecting your whole body. There's a few characteristics of leaky gut syndrome, but it can cause lots of symptoms, and I'm going to tell you how important your gut is to your health overall. So sometimes we have to do a test to figure out whether somebody has leaky gut, but two of the most common things, anybody here who has a lot of sensitivities to foods? Yes, okay. So that's a sign of leaky gut. Anybody here who has autoimmune problems? You know what those are? They're really where your body attacks itself. And so people who have autoimmune problems like rheumatoid arthritis, lupus, even thyroid problems can be your body attacking the thyroid gland. If we fix the leaky gut, then those things get better, sometimes go away entirely. And the way that they are treated traditionally is sometimes called immunosuppressive drugs, just to suppress the symptoms. And that's not a very healthy approach for long term. But some of these other symptoms are pretty common, and I just want to at least go over some of them. So let me teach you a little bit about the gut in general, how important it is. So many of our neurotransmitters, those are the messengers that carry messages between our nerves or between nerves and the brain, and they're made in the gut, especially something called serotonin, a very, very common messenger. And sometimes because the gut is not healthy, it's not producing enough serotonin, and lots of people are on medications to improve the amount of serotonin that their body can utilize. So, but 90% of it is being manufactured in your gut. The gut contains two-thirds of our body's immune tissue. The gut contains 10 times more cells than the rest of your body combined. And 70% of people have digestive problems, which can strongly affect overall health and well-being, even brain disorders such as depression and anxiety. Recently, there's been a couple of departments of nutritional psychiatry, and it was actually started in Harvard and Stanford. And so there are doctors who are combining nutrition and also sometimes psychiatric drugs or nutrition, psychiatric drugs, and sometimes behavior therapy. But they found that when you add nutritional counseling in, and that if that's part of the problem, you get tremendously better results. And sometimes you don't need the other two things like behavior therapy and also medication. So all I want you to remember is there are many ways to fix the same problem. And if you've been to a doctor or nutritionist or anybody and they say, we've done our best. I don't know what's wrong. I can't help you anymore. Maybe not everything was tried. And that's why my experience has helped me help people with difficult problems. Okay, what is the gut? Okay, so it starts here and ends with your bowel movement. Okay, so ingestion, taking food into the body, digestion, breaking down the food into smaller molecules, moving nutrients from the digestive tract to the bloodstream, and eliminating undigested waste products from the body. So if there's problems with any one of those parts of the function or any one of those functions of the gut, it leads to problems. It doesn't really, you're supposed to have all those areas working well. So even something like constipation is a sign of holding on to waste products too long. Diarrhea is a sign of trying to get rid of something that your body really doesn't like, or it could be even a bacteria or a parasite. And so we look at those things, and sometimes it starts in the mouth, where people don't chew enough, or they don't take their time with eating, but you have to look at all of those factors. Parts of the gut are the mouth, esophagus, stomach, small intestines, large intestines, rectum, and anus. What decreases healthy gut bacteria? I'm going to take this slide away. Give me some examples of what you think damages the bacteria. Not eating properly. Yeah, I agree. Medication, that's another one. Yeah. So a lot of them are caused by either our lifestyle or even what doctors have prescribed for us. It's not allowing our body to function the way it's supposed to. Sometimes medication is necessary, sometimes it's exactly what you want. But if you're looking for something that could be done as an alternative, that's when somebody like myself is necessary. So let's talk about what are some of the things that decreases healthy gut bacteria. Medications like antibiotics especially can really have a long-term effect on the health of your microbiome. Oral contraceptives, proton pump inhibitors, steroids, and non-steroidal anti-inflammatory drugs. Stress. Anybody here who has no stress? Anybody? No. So I ask that question all the time. Everybody gets a chuckle out of it, but we all are living, especially now, I think, in a stressful time, just because of, how much the news is actually on all the time. We have so much access to news that really can be stressful. But sometimes it's going to the mailbox and, seeing too many bills, that can be stressful. Sometimes it's pain that can be stressful. Sometimes it's a mental worrying that can be stressful also. So there are three categories of stress: mental, physical, and chemical. Anybody have an idea of what mental stress could be like? What could it be like? Because it got a reaction from you. Family is a big source of stress. Your children, your spouses, relatives, parenting, parents. Yeah, and it can be very, very stressful. And if you don't do something, I'm going to give you a solution to it also, or at least one solution, as far as stress is concerned. And everybody who comes into my office gets measured for how stress is affecting them by a questionnaire that I use and also a test that I do. Because everything, especially stomach problems and digestive problems, can be very much affected by stress. Anybody ever feel flutters in their belly, if they're under some stress or, something that's going on there, it's mentally stressful, but I'm feeling it in my gut. Anybody ever say, oh, I feel it in my gut? Yeah, it's common. And I'll tell you why. Because the brain and the gut are connected neurologically with nerves. And so anytime you undergo some stressful situation, your brain is sending a message to your your belly, telling it something stressful is going on. And what the solution to that is that it diverts blood away from your stomach and your digestive system, because that's not the emergency. Okay. So your body wants to conserve energy for an emergency. That's what stress was really designed to do, actually handle emergencies. But we're different now. We don't have constant emergencies, but we have a lot of chronic stress that's going on. Sugar and high fructose corn syrup are two of the worst foods for your digestive system. Artificial sweeteners are equally bad. Oh, sure.
Isn't there what's the natural or stevia?
Yeah.
Is that good or bad?
Not very good.
Not good?
No. The word artificial is the real problem. So there are some that are made from the plant itself.
Yeah.
Without anything, I would say you have to look them up. And if there's nothing else in it except stevia plant, then that's a decent one. But there are better substitutes for sugar than that. Sweet fruits, actually, like dates or bananas, or monk fruit is another one, or honey or maple syrup. You want to try and use something that is a real food as much as possible, not something that was made in a plant. So if it's made in a plant, try to stay away from it. If it is a plant, chances are you can have it. Yeah, dates are a wonderful sweetener for baking. Yeah, for baking, and I think that honey and maple syrup are also a fairly good choice, but you can't pour a whole bucket on. You got to kind of do it within reason, and not everything has to taste sweet. But if you want a little bit of sweetener, those are some of the ones. Monk fruit, dates, and I would say honey or maple syrup are some of the best choices. Gluten. Anybody been told that they're sensitive to gluten or think they might be sensitive to gluten? Yeah, very common. About 60% of the population, gluten is in grains. And I'm going to explain to you why gluten is so commonly a problem. First of all, the grains in this country are different than the grains in Europe. So the grains there have been raised differently. They don't have all the pesticides and herbicides. They've been manufactured differently. They're a different breed of grain. If we just talk about wheat. And those grains are less sensitizing for your body. But in this country, the motivation is to make a profit. And it's not to keep you healthy, quite frankly. So you have to learn about why certain foods might be bothering you. And sometimes you can substitute something else. Sometimes you can help your gut recover, and you're not sensitive to it for life. But gluten is a big one. So we do sensitivity testing. So allergy testing is, in my opinion, not great for foods and things in the environment. So, but food sensitivity testing, I think I have a slide on that, and also a test for gut barrier panel to see how your gut barrier is. Very, very simple test. So finger stick, send it away. Get great results helping people identify that. Food and environmental allergy, insomnia, toxins, low levels of omega-3 fatty acids in our country, low levels of vitamin D. All of these things lower your immune system and raise inflammation. Radiation, chemotherapy is something else that hurts the gut. Excessive alcohol, pesticides. And you know what the SAD diet is? The standard American diet. That's what SAD stands for. So our country has really, really used a lot of foods in this country and also exported it to other countries and really made other populations sick. Those countries, lots of them never had McDonald's and Kentucky Fried Chicken and Taco Bell and everything that we have on every major street. And now they have some of the same illnesses and the same incidence of illness that we do. So food is a major factor. And there's so much misinformation about food. We need someone who's had experience dealing with what's good, what's bad, because there's a lot of myth out there. And if you believe what you're seeing on television, that's not going to help you very much. So your gut is not Vegas. You ever hear the expression, You know, what happens in Vegas stays in Vegas? Yes, no, maybe? Okay, but when I use that term, what happens in the gut doesn't stay in the gut. So there's a two-way communication between your brain and your belly. And every time something happens here, it's affecting what's happening down here and vice versa. When this is irritated, it's affecting your brain also. So lots of mental symptoms are related to gut problems, and lots of gut problems are related to mental symptoms. Very common. Supercharge and heal your gut. 60% of our immune system resides in our gut. Healing your gut decreases inflammation, which is connected to obesity and nearly all chronic diseases. And you've got to add some things to your diet. You can't do the same things or subtract the bad things. And everybody's a little bit different. There's something called prebiotic foods. Those are the things that your gut bacteria live on: garlic, onions, leeks, artichokes, bananas, apples, and probiotic foods. And fiber is also a very, very important part of our diet. Probiotic foods like grass-fed beef, cow, or coconut yogurt, fermented foods, very, very healthy for the gut too, for certain symptoms. And it's not like everybody responds the same way. And the type of yogurt or sauerkraut or what's in it makes a big difference, and your symptoms make a big difference. So you have to have the right prescription for those things. Okay. This is a little something about, anybody here of Crohn's disease? Yes? Okay. So if you know anyone who has it, it can be a devastating disease for life. And I've had several patients who have been able to get off of all drugs and really do what I've told them to do with diet and really, really improved it tremendously. But I'll read you a story about one. 4 years ago, I was coaching a soccer team. I had to go to the bathroom. My stomach hurt so much, and I knew something was wrong. I called my mom, and we went to the hospital. At the hospital, they ran some tests, ordered a colonoscopy. I was seen by a GI doctor at the hospital, and two others said the same thing. This is really important. The only options for treating Crohn's disease were steroids and immune suppressant drugs, and if they stopped working, I might need surgery for my colon. So this is some opinion that a doctor will give a patient based on his training or her training. It's not truly scientific fact, because I've proven that people can get help without using medication and without surgeries. Dr. Markowitz mentioned he had helped many people with Crohn's disease by reducing the harmful effects of stress and foods that were making the disease worse. He suggested a food sensitivity test, which is what I mentioned to you. I'm sorry, how do I pronounce your name? Stina? Yes. So food sensitivity test is what I'm talking about, because really the reaction from food is not a true allergy. Allergy is something that happens very suddenly and more severely too. Sensitivities are very important, and they add up. You can have a whole bunch, especially if you have a leaky gut. I began treatment by avoiding these foods, and gradually I was able to return to many of them to my diet. 4 years later, I feel healthy, back to my old self. I was a happy and very positive person before I got sick with Crohn's, and I am one again, where I don't have to worry every 5 seconds, where's the bathroom. If it wasn't for Dr. Markowitz, I'd be on the medication, because every GI doctor told me that that was the only route. Boy, were they wrong. Dr. M was amazing. It's really helped me. I wouldn't be where I am today without his guidance. So think about if you've been told there's nothing else that can be done. It has to be a medication approach. It has to be surgery. Before you do those things and say, oh, that's the only way that this could be helped, that's not necessarily true. The pharmaceutical industry sold over 96 billion in drugs to treat digestive related conditions. It's one of their biggest money makers, quite frankly. And many of them with adverse side effects. We mentioned a few of them. So these things actually ruin your gut, and they damage the gut, and they also sometimes don't allow you to absorb nutrients the way you would otherwise. Some common medications, and some of you may be on these: diarrhea related to metformin and antibiotics, constipation related to opioids, peptic ulcers related to non-steroidal anti-inflammatory drugs, malabsorption related to drugs like Nexium or Prilosec, reflux caused by antidepressants, and impaired immunity caused by immunosuppressive drugs. Anybody on any of these medications? Just out of curiosity. No. Yes? Maybe. Okay. Okay. The pharmaceutical industry is the #1 industry on political lobbying. They spend more money convincing our legislators that what they want them to do is going to be good for the public. And they really are just thinking about the economics of it more than anything else. Pharmaceutical industry doesn't create cures. They create customers. And that's, I say that because their goal is to give you a drug that you're going to have to be on for life. That's their goal. Because they make money every time you use it. And as long as you keep using it, they're continuing to make money. And if there's some way we could break that cycle, or you would want to break that cycle, that's what I do. I help people try. Doesn't mean you have to give up every medication. I would never take you off of any medication without your agreement and your doctor's agreement. And so I would say, but many times you can reduce it or limit the need for medication. How do we help the digestive problems? Okay, there are 4 pillars of health restoration. And it doesn't mean you need all of these, but it helps if you use all of them. Rhythm resetting, that has to do with stress. Anybody ever hear of the hormone cortisol? Cortisol? So that's an inflammatory hormone. And if we do a test that measures that your cortisol's all over the place, instead of being a nice curve like this, supposed to be higher in the morning and lower at night. And so that you can go to sleep, because it controls how you wake and how you sleep. And so that's important. Nutritional healing, probably the most important thing. If you're eating junk foods or foods that aren't as healthy as they should be for you, that makes a big difference. Handling stress, that makes a big difference. Handling it in a good way. And I'll tell you a little more about that. And functional therapy helps people actually function better if they have pain or if they have problems with their function. Okay. So what we're going to cover are a few things. The purpose of this workshop is not to convince you of anything, but to provide you with facts concerning digestive related conditions and the natural treatment options available to you. Strategy #1, improve digestive problems and overall health naturally. So this is what I call the SAD diet. It causes all of these things. This is what we know. Why aren't doctors really, instead of giving you a medication for each one of these things? For each one of these things, let's fix the diet, and all of a sudden, all of those things improve. So 70% of these symptoms, these conditions improve within the first month or 2 of doing the right things. So food can be our best medicine or our worst enemy. Food can be your best friend or your worst enemy. So if you're eating fruits and vegetables, your body likes that. It feels good for you. If you're eating pizza and beer, it doesn't like that too much. And so that doesn't help. And there was a very famous doctor, his name was Hippocrates. Everybody hear that? Hippocratic Oath. So this was what he felt, was that food was really the key to health, and your gut was really where all health really resides. If your gut is unhealthy, it can't be as healthy as possible. So 3 major categories of stress: physical stress, emotional tension, and chemical imbalances. 90% of all medical visits are in some way related to stress. Some way. It doesn't mean that it's the entire cause. Doesn't mean it's in your head. It means that if you don't pay attention to that, it's going to aggravate problems. And I'll tell you how you can do that. So these are some of the problems that stress causes commonly: sleep problems, headaches, fatigue, weight gain, mood swings, allergies and sinus problems, digestive problems, and pain. And so somebody by the name of Dr. Markowitz said, increased stress requires increased healthy habits to reduce the harmful effects of stress. What do most people do when they're under stress? What do they do? Good things or bad things? Huh? Eat. Do they eat good stuff usually? No. Okay, so they crave the bad stuff. You know why? Because actually the food industry has made us addicted to those things. So it's not your fault entirely. But I'm trying to educate people about that. So the more healthy things that you put into your body when you're under stress, the less the stress will affect you badly. So I would say you need to counterbalance the stress, especially when you're under some stress. People who are under stress sleep less, sleep worse, don't exercise, worry more, eat more, don't pay attention to doing exercise on a regular basis. They don't do any of the healthy things, or not as much of them as they should. Recent studies have shown that stress-related conditions directly contribute to gastrointestinal symptoms. A study done at the Cleveland Clinic in Ohio came to a similar conclusion as Dr. Sellier, which found that when a person is under stress, this is really pretty important, the body diverts blood flow away from the digestive system because it's not the emergency system. It sends blood to your muscles and to your heart because we want to protect the most important organs if you're under stress. Your body thinks it's an emergency. You thinks you're being chased by a saber-toothed tiger from old times. So it can cause symptoms like indigestion, diarrhea, constipation, difficulty holding on to your urine, or colon spasms. Stress also increases acid production, which can aggravate ulcers and contributes to acid reflux. So all I'm giving you is one example after another of how you got to get rid of the cause of the problem instead of covering it up. And these are stress reduction techniques that you should use regularly. Diaphragmatic breathing, meditation, yoga, progressive. Anybody use any of these? Yeah. Okay, good. So you're doing some of these things. You could check that off the list. Those are the things that you do more of, but you don't have to learn a great deal about it if you're already doing it. Strategy to improve digestive problems, overall health naturally, enhancing sleep. Is there anybody here who wants to age faster and heal slower? Anybody? What do you think? Good idea? Aging faster and healing slower. So if you don't pay attention to a sleep problem, that's what happens. You age faster and you heal slower. If you pay attention to it, and the solution is not Ambien or Lunesta or Tylenol PM or vodka or wine or scotch or anything else that you're thinking, it's really figuring out why. Why, not what, why you have a sleep problem. And it's not because of a missing CPAP machine either. That's not the real cause of the problem. What position do you sleep in? That makes a difference too. How many people sleep on their backs? Side? Okay. Stomach? Okay. How many people don't sleep? Okay. Thank you. You go back to sleep easily? Yeah, that's a good, that's a good solution. So I use something like that myself at times when I wake up in the middle of the night. But the reason usually that we wake up in the middle of the night is that cortisol hormone is too high during the day and spills over into the night. So you can also do some things to balance it for the day too. Decreasing pain, also important. I mean, if you're in pain or your body is working extra hard, doing all sorts of things, just sitting and standing and sleeping, then you're also going to harm your overall health and even affect your digestive system. Digestive problems and overall health naturally by permanent weight loss. Why do you think weight loss is really an important factor? What do you think? Yeah, go ahead.
All the other harder.
Carry extra weight. Yeah. There's another. Well, go ahead. Anybody else have an answer? Okay. So really, one of the main things is every fat cell that you have in your body is like a hormone factory, an inflammatory hormone factory. And the more extra weight you have, that means those cells are bigger. We don't get more cells as we get older, but they get bigger. They store more fat. So the more you can get rid of those or shrink them actually, you will have less inflammation in your body overall, and you'll feel better, and you'll have more energy, and you'll have lots of things improve because of that. So weight is a big factor, not just because of the pounds, not just because you're carrying more weight on your joints, but because of the hormonal effect. So increased weight increases inflammation. Not all calories are created equal. So this is something that I saw a couple of things in the grocery store once. But one of them that caught my eye, and it said 100 calories package of Oreo cookies. So, and it gets a lot of people to buy them because they think calories are what are really important. What's really important is the quality of the food. So 100 calories of Oreos have a totally different effect on your body than 100 calories of broccoli or spinach or any kind of fruit or vegetable. So you really want to try and limit your need for sugar and starches, especially. Fats don't make you fat. Anytime you see low fat, I would generally stay away from it also because they put other things in there to substitute for it. Increased weight is a common cause of sleep apnea. Learn how to control your blood sugar with diet and exercise. Avoid unnecessary drugs. Improve your digestive problems and overall health naturally by testing strategies. So I mentioned a couple of things. One is called the Adrenal Stress Index. It's where we test your cortisol by saliva. So I'll read a little bit more about it. And then the food inflammation testing and gut barrier panel is another test that I do. Warning signs of leaky gut, multiple food sensitivities, lots of fun. You know, if you're sensitive to a lot of things, chances are your gut is like a screen door that's letting stuff in where it doesn't belong. Autoimmune problems. This is a screening test for stress that I'm going to tell you about a little bit more. And it's really where we check a person's blood pressure the first time they come in sitting, and then we check it standing. And someone who has blood pressure, let's say it's 110/80 when they are sitting. When they stand up, it goes down to 90. That means their stress fighting system has gotten tired and it's pooped out, and you need to help support that. And then lots of things get better. Another test is how your pupils react to light, because that's controlled by your stress system. So if you are driving, anybody has a problem with bright lights or sunny days, yes, that's another sign of it. And so you could be amazed at how many things could be helped just by helping this. If you are sensitive to bright lights, or sometimes if you feel lightheaded, if you stand up quickly, that's another reason to check that. And that's one of the first things. I do that with every new patient that comes into my office. So this is the Adrenal Stress Index test. I'll give you a little information about that. So measure specific chemical messengers. It's a period of blood tests for assessing daily hormonal balance and rhythm. Why didn't my doctor tell me about this? Well, you'll have to ask him. And I would say what I think is that there simply isn't part of their training. And that's after talking to numerous doctors one-on-one that worked with me or for me. And so, but why? Why didn't they get trained? Because most doctors are trained to prescribe medication, and this approach requires more than that or something different. So it takes a lot of time to figure out what's wrong with somebody. It doesn't take a lot of time to write a prescription. It's pretty quick, and there's no relationship to the cause. So just keep going here. Most doctors spend their time in the top part of this, where all of these symptoms are, and then they really should be focusing on the bottom part where the underlying root causes are. It's like the soil. Think about, a plant won't grow well if the soil isn't good. So we have to check the soil and see why the plant is not growing well. Okay. The ASI tests for other things besides cortisol. Digestive function, inflammation, actually tests for gluten sensitivity, inflammation is part of the test, hormone balance, and potential infections, and more. This is why many approaches, good approaches, fail because they are incomplete. So what I'm saying is, just like a puzzle. Anybody like to play puzzle? We use, make puzzles. But anyway, if one piece of the puzzle is missing, you're dissatisfied with the whole thing, and it doesn't complete the puzzle. Another thing is like a splinter. If you don't take the whole splinter out, where you've got more than one piece of the splinter in there still, then you really still have symptoms. So it's very important for whoever you're asking for help gets rid of all of the connections, all of the problems. It's really comprehensive. So I belong to an organization called the Foundation of Wellness Professionals. And every year I provide 30 educational workshops on natural health to the community. That's why I'm here today. And I invite attendees of these workshops for an educational visit to our wellness center to determine natural solutions can be utilized to solve their health problems. So if you want more information, I mean, this was a lot today. And so if you use some of it, that's great. If you want to know more, because you think, it's hard to do on your own, then I'm available for a free consultation by phone to see if I think I can help you. And really it's to discuss what you've done already to help yourself with any particular problem, what has worked, what hasn't worked, what your health goals are in both the short and the long term, what questions do you have? And if it's determined that we are a good fit, you'll have an opportunity. And the opportunity is a comprehensive 1-hour consultation evaluation. And then, so you can schedule that now or only after a discovery call where I find out that I think I can help you and I'll tell you, you say, oh, great, I think that sounds interesting. That sounds worthwhile. And that we reduce the cost of the visit, it's $95. Because I don't want it to be an obstacle to people. This is new and different and they really don't know enough about it. But if you're willing to make an investment of $95 after talking to me on the phone, then I think you'd be very happy. What's in the test and the evaluation? A screening test for stress, computerized posture evaluation, testing for undetected nerve damage. These are usually things that aren't done in your doctor's office. Diet diary review, measurement of body fat, computerized foot scan, insurance benefits verification, and a customized plan to address your health concerns, including the cost. So there's no surprises. I don't surprise anybody. We tell you at the end of that visit what it includes. So if you'd like me to call you to discuss my health problems before making an appointment, or you'd like to just go right to the consultation and comprehensive evaluation, you can check off that box, come up and see me, and we'll come up with some times that are good for you. And if you have any questions, let me know. And for those of the people on Zoom, if you'd like to contact our office to schedule a complimentary Restore Your Health Discovery call, then please call 203-798-WELL. It's an easy number to remember. And you can always look for me, Dr. Ed Markowitz, or you can ask the library how to get in touch with me. Yes.
I have a question.
Sure.
What are some of the things that help skin?
That's a good question. It shows imbalance and it shows less than ideal structure. So it's not for pathology. It's not, well, the foot in general. Yeah, and how your arch is, how much weight you're carrying on one side and how it affects your body. And so if you've got a knee problem on the right side and you've lost the arch on the right side, that's connected. It's not ideal. It's like having a poor foundation. So if I ignore that, you're still going to have a knee problem on the right side. And you could take medication, you could, ultimately need surgery, like a replacement, but my feeling is if you catch this early enough, you can do a lot about it and feel better.
I think personal, so I will follow up with you, but why you would have dairy fries?
There's a lot of reasons. I would say I have to talk to you a little bit more and look at your diet diary. Also ask you how much water you drink and see if there's anything else in your diet that's missing that would help you with your skin too. I think it's diet. And sometimes it's a food sensitivity also. Have you ever had itchy or scaly skin of any kind? Have you ever been told that you might have eczema, anything like that? No. Okay. Anything different happened 4 months ago? No, you haven't done anything different at all. Okay. Is it all over your body? Dryness?
Like lower.
More on the inside, on the back of the knees by any chance? Huh?
A little.
A little. So it could be. If that's the only time it happens, maybe. But I think those are not that's not my first inclination. But if I look at your diet talk to you about also how much water you're consuming, maybe what supplements you might be taking also, and what you might be missing, you know. Maybe
The biggest people are not drinking enough water.
can. Yeah, water is so important. You know, people don't drink enough water and they don't even know what enough water is. So enough water is about half your good. I'll show you mine. Here's mine. So I could use a drink. So anyway, yeah, half your body weight in ounces of water is how much water you should be drinking actually. So it helps everything. Every chemical reaction in your body is dependent on water. Your kidneys are really, really, really affected by lack of water. So keep drinking water. And it should be the best water possible too. Clear, you know, filtered water ideally. And I would say,
Okay. Example, they have really hard water.
okay.
Does that affect your?
Yeah, it can. Yeah, extra calcium in the water also.
Does it help to get a water softener or just?
Yeah, I think probably a pure, but before I give you an answer, I want to know more. Okay, so I want to not give you something that really isn't the answer. So I check your diet also, talk about how much water you're drinking, talk about what supplements you're taking already. So it could be no supplements. Okay, that's fine. Usually the testing is covered, okay, and insurance. And so also pain-related treatment is also covered, and everything else we tell you what's not covered and how much it would be. But you know, you've been to doctors and you know, insurance companies cover what they have decided the doctor should do. That's really what it is. It's not your doctor deciding. They're telling the doctor how much time to spend with you. They're telling the doctor what medications to give you that are covered under insurance. They're telling the doctor, you know, they're directing the care. And I never wanted to be directed by the insurance companies. So, and if you're still having problems, then you got to decide, I want to fix this problem. I'm tired of this.
I don't.
Well,
I agree with that. I would think about one something.
okay. Well, I think I mentioned it before. You know, everybody has an idea of how to make themselves healthier. But you need a great coach in order to get the most out of it. And I said, you know, would you go try to fly a plane if after listening to somebody who's a pilot talk to you about how to fly a plane? Would you go fly a plane? Yes or no? No. So don't try and, you know, really guide your body through the rest of your life without finding out exactly how to fly a plane. Uh-huh.
For over a year.
Okay.
Why?
I'm not a big fan of Brazilian supplements. So
I have
yeah.
doubt.
Okay. I have to ask you what problems you're having, what you were trying to solve, what they tried with you and didn't seem to help. And then I would tell you whether that would be my approach or whether I would do something's being left out, like that splinter. You know, so not every nutritionist or doctor has all of the answers, but I try to be as comprehensive as I can. I don't want to miss anything. So the first thing is talking to me on the phone. And the second thing is if you decide, hey, yeah, maybe there is some more that he could teach me and help me with, and to go for that complimentary evaluation.